what my colleague has told is in erectile dysfunction it doesn't work so well, but we are actually selecting a group of patients. You can see here, he said there is no evidence at all. We have tried objectively by flow mediated validation, which has shown very good results, and most of the scientific data for this is available in terms of they have actually ligated the profunda artery of a rabbit and tried to do low intense shock wave therapy. I will show that how it is. It helps. You can see here collateral development in a shock wave in a rabbit. This shows this is a femur here. The blood vessels which are ligated after the shock wave was given. The capillary density before the treatment was around 1200 capillaries per millimeter square. Here it is 1500 and more, which showed that by actually intentionally ligating the artery in a limb, lower limb in a rabbit has shown that the revascularization or neovascularization has actually made the limb survive, and it was also done by myocardial area. They have ligated myocardial one vessel, and that also has revascularized after some time, and that's why this method is also used in the myocardial infarction patients where they failed after bypass surgery. It is not a useless procedure, it is useful in selected patients. European guidelines are very much in favor of that, and I never said that this is a final cure for this. It actually helps in patients who are really having erectile dysfunction due to decreased diameter of the vascular tree, and that has been documented by seeing this. This is the myocardial area where there was ischemia here. After the shock wave therapy, it is actually neovascularized and then vascular has improved. So it has been used in several places. It's a good machine once you select patient properly, and the recurrence he told about 24 months, it's not true. The recurrence of 8 to 12 years has been reported by Thomas Wadi et al. So I always think that a patient who doesn't respond to PDE5, you can give a worthy trial. We tell the patient that in about 70 to 80% of patients there will be improvement. If it doesn't improve, the options are well. We have not damaged the patient, we have not done anything incurable to the patient.
Thank you so much, sir. Thank you for the rebuttal. May I have Dr. Munna back again for his final words?
Yes, it works wonderfully until you switch the machine off. That's when you realize the strongest shockwave was actually hope. Safe does not mean effective, and some patients don't need shockwaves. There is a lot of psychological overlay. They just need sleep and less WhatsApp forwards. Coming to the evidence which was mentioned, the evidence is mostly in the animal studies, and it is a proposed heterogeneity among most of the studies. If evidence is strong enough, it would have been already in the guidelines rather than experimentations. And for the available evidence, if it was a drug, it would have been in phase 2 trials, but somehow it has already been in phase 4 marketing. So medicine should advance by evidence, not by excitement. And the results which improved are just like New Year gym memberships, excellent results in January, absent by June. And if you ask 5 years WT clinics about their protocols, they will give 7 different answers. Energy, pulses, sessions, outstation patient or local patient, and one clinic even adds free counseling. There is a lot of standardization still had to happen. And coming to the device focused, radial, linear, electromagnetic, at this point it sounds more like a musical playlist rather than a medicine. So it is not only therapy, it is the only therapy where the bill goes up high rather than the IIEF score does it. So if you ask a patient after ESWT, they say doctor improvement is there, but only when everything is perfect, good sleep, no stress, no alcohol, no quarrels with my wife, and no relatives visiting my home. At this point even it improves on its own. And there is a lot of over-commercialization happening in metros in the name of experimentation. A lot of clinics are opening faster than coffee shops, at least coffee guarantees performance. So coming to the guidelines, promising doesn't mean proof, they still say it is experimental. So I close my statement that I don't say ESWT is fake, it's just not ready for the marriage yet, it's still dating evidence. Currently it belongs in clinical trials, controlled protocols, and only when it is clearly indicated. Hope is powerful, but evidence must try. Thank you.
So thank you both the speakers for putting the points for and against. And of course, the expectation from the session is not to have a war of words. It's for the audience to take home a message. And for that, the role has been assigned to me to moderate and give a final verdict, if I may. So basically, it's a difficult task because there is no final verdict on this. I believe that this technology, because I remember the trial when I was in Polyclinico 2 and Medispec 1000 had come, and we were still doing trials around Peyronie's disease and ED. And it's been there now for 11 years in the market. So the first thing that I would want to say is don't shun the therapy away just because we don't have a clinical evidence. There must be something in this modality